Welcome to Dr. Ram's Medical Coding Academy. Let's talk about the modifier Q6. Modifier Q6 in medical coding is used for indicating that services were provided by a locum tenens physician. What is modifier Q6? Definition: service furnished under a contract, locum tenens physician. Purpose: it is appended to procedure codes when a substitute physician, locum tenens, is temporarily filling in for a regular physician. Time limit: the locum tenens physician can provide services for up to 60 continuous days. When to use modifier Q6? The regular physician is unavailable, e.g., vacation, medical leave. A locum tenens physician, not a permanent employee, is hired to cover for them. The regular physician bills under their National Provider Identifier, NPI, appending modifier Q6. Example scenario: a family physician is on medical leave for 30 days. A locum tenens doctor covers their patient visits. The services performed by the substitute physician are billed under the absent physician's NPI with modifier Q6 attached. Key billing considerations: checkmark the locum tenens must be a physician, not an NP or PA. Checkmark the regular physician must remain enrolled in Medicare. Checkmark services must be identical to those typically provided by the regular physician. Checkmark the 60-day limit cannot be extended. A new locum tenens must be hired if needed. Now, show effective tips for keeping focused when studying. Explain each tip to let your audiences know what to do exactly.